Hi, I'm Professor Mike Strahan. I'm the librarian for School of Clinical Sciences, which includes radiography, CLS, speech path. And in today's video, I'm going to show you how to search PubMed for a medical condition or disease. And we're going to be looking at different aspects, different types of treatment, such as drug therapy, which of course is medications. We're going to look at surgery. We'll look at other types of possibilities of treatment. So the first thing you want to do is start with the library guide, the one that we have for CLS and radiography and all the others I'm going to share with you now. This should be linked inside of your course. I'm usually embedded in the radiography courses and the nursing courses, etc. And if you have questions, over on the left-hand side, you can email me. If you see this box, that means I'm available for live chat. And if I'm not available online, like I said, you can email me, you can call me. There's also a forum, a library forum inside of the courses where I am embedded, and you can post your question there. Plus, I'm available on campus at different times. I have a link here that will show you where you can find me if you want to come and visit me. So we're going to start off with find articles. And it's really important that you use the link that we provide for PubMed. We have a partnership with them. And so that allows you to see this northern icon inside of entries, and that provides a connection with the 85,000 journals that we subscribe to online, including thousands of medical journals. And most of those you won't find online for free unless you go through Northern's subscriptions. So we click on PubMed. Next thing you do is click on Access Database. Now, if you are going through Northern's LTE network in the UP, or if you are going through on the network on campus, the Wi-Fi, things like that, anything connected with Northern, after you click on this link, it usually will not prompt you to log in because it automatically recognizes you as being part of Northern. However, if you are using Spectrum or some other type of internet access, you will be prompted to log in with your username and password. Same thing that you use for EduCat, and also with your Northern email. So we click on Access Database. And what you want to be doing is we're going to start with the mesh database, because here's the deal. We could do a keyword search up here, and we could type in all these different aspects, but the problem is it may not specifically apply to this particular disease. You can have articles that are talking about a patient with multiple diseases, and it may be tied to those other diseases and not the one that we want to be researching. Okay, so let's click on Mesh Database, and we're going to do kidney stones. The medical term is kidney calculi, and they give a definition of it. They also give you all the different subheadings, the different aspects that you can choose. And then they have related terms and then an outline of how that term fits in with the rest of the hierarchy in the medical subject headings organization. So here's what we want to look at. We're going to look at statistics. We're going to look at, which of course is epidemiology. We also want to look at causes. Medical term is etiology for that. We also want to look at diagnostic methods. So we're going to do both diagnosis and diagnostic imaging, especially for the radiography students. And let's see. We've got We may want to look at prevention and control. I don't have that on my list from the instructor, so we're going to leave that off for now. But we can also look at different types of treatment. And of course, it doesn't mean that it won't include that. So we have therapy, we have surgery. I'm going to keep away from rehab for now. We have radiotherapy. We also want to be looking at physiopath and perhaps pathology. Let's see. Oh yeah, we need history. We want to look at articles that are talking about the history of this disease. And any other treatments in here? Complications, usually we'll pick that up. And we don't forget diet therapy and drug therapy for the medications that are prescribed. What it will do is it'll bring up articles that include any one of these, along with kidney calculi. As opposed to articles, you may get a couple articles that are talking about all of these things together, but that isn't necessarily the case. This is also, all of these aspects are tied to our condition here, the kidney calculi, that particular term. Over on the right, we click on Add to Search Builder. We click on Search PubMed. And we get 18,000 results. It kept where I was doing last time, which was the most recent. If you don't want to have that arrangement, if you prefer something that's a little bit different in order, the default is best match. And we can definitely do that. If we change that to best match, same results, different display. The other choices here, most recent, are not the most recently published. That was the default that came up. It's the most recently loaded into the database. And so if we want to look at the most recent articles, instead we can choose publication date. That sorts it in reverse chronological order. Other ways of limiting our results, we can limit it by years. So we can tell it, I would say, the last 5 years. Check with your instructor, usually the last 5 years will work for us. We could limit it to full text, but the Northern's Library subscribes to 87,000 journals online. And many of those thousands are medical journals. And so you don't want to limit yourself. If you only want to look for 1 or 2 articles, definitely you could limit it to the free full text. But if you want to look for the best articles, then definitely you can uncheck those. We're not looking for any particular type of article, but I do want to do some other limiters. And to do that, I want to look at what they call the additional filters. So I do want to limit it to English language. And I also want to limit it to humans. And you're saying, well, what's the big deal? PubMed is a medical and biomedical database, meaning that medical research articles on animals also show up in this database. They're indexed. And so if we're only looking for kidney stones in humans, so those are the types of articles we want to restrict our results to. You can also limit it to gender, either male or female. You can limit it by age group, but that will suffice for our purposes. So I've got the last 5 years, I've got English and humans. And so the first article that I have here, it actually says it's free. I can click on that title. It gives me a short version of the citation, gives us an abbreviation for the title of the journal. PubMed is known for that. They abbreviate all their journal titles. It saves a lot of space. The database itself goes back to the mid-1960s, and so because of that, you really want to conserve as much space as possible. plus they're indexing tens of thousands of journals. So we have the abbreviation for the title, and you just hover over it and it'll tell you the full title. We've got the year it was published, the volume number, in this case 47. Issue number 1 is in parentheses, and they've got just one number, meaning that this journal is using article numbers. It is not using a regular pagination, let's say page 50 to 55. It also provides the DOI. Then we have the title of the article, the authors, and it gives us an abstract. And this abstract appears on the article itself. It's written by the authors. They bring it into the database. So you can read through and understand what these articles are talking about. Plus the fact that if you scroll further down, it will show the figures. They'll give you links to similar articles that are indexed in PubMed to this particular article. They give you, for those that are full text inside of PubMed, they also give you the references. And then the mesh terms, the medical subject headings. So we can look at this and we can say that this is talking about kidney calculi, blood analysis, and also epidemiology. Statistics, right? And it's dealing with males, it's talking about risk factors. And the asterisk means that is the focus of the article. So now if we want to look at the article, go back up to the top here, you can either click on the free full text, or because this is an open access, you can click on a link to the publisher's site. Either one will bring up the same article. So if I click on the PMC version of this, it brings me to this screen. Download the PDF. All of our licenses with our journals, either in a group of journals in a database or directly from the publisher, includes downloading articles. So we click on the PDF, because you always want to look at the PDF. You want to see how the article was originally written by the authors and how they want it to be read, how they want it to be laid out and formatted. So we've got the PDF of the article. We click on the download button. I have already a folder called RAD. So I'm going to give it a name because numbers don't do me much good. So we have atherogenic. Click on save. Mine's configured to automatically open it up in Adobe Reader. And we're pretty well set to go, except for one thing. We want to be able to cite this article because we plan on using it in our paper or our presentation. And so to do that, we click on the CIT tool, the cite tool. The default is going to be NLM, National Library of Medicine format. Yes, they have their own format. AMA does too, a few others. For most of the programs, radiography, especially nursing, especially, you're going to be using APA style. So we can change this to APA format. It reproduces as it was appeared in the index. So for example, if every significant title in the article title was here and it was capitalized, it doesn't convert it, it just duplicates it. And so what you would do is you can copy this, then you could email it to yourself. You can also put it in a paper so you can keep track of it that way. And then make the changes according to AP style, which in this case would be to capitalize the A following a colon. Capitalize the title of the journal. Also significant words are capitalized. And because this is a number here, they're using article numbers or document numbers instead of actual pagination in each issue. And so you would preface this with the word article. I do have examples on the library's APA guide that will show you how to format that. To go back to our results, you click on this, or you can hit the back button. And I was curious about whether we had some of these other articles, because this one was easy. It was ready full text in the database. And I was also curious whether we could pull up any articles that just deal with the history. And we could do that because it did an or here. It looked at any of those things. So I've got the diet therapies, the epidemiology, the etiology. Here's the history. So what we could do is let's tell it to not include these other things. So I got the history or pathology. That should work. And it turns out quite a number of them. And if I wanted to get rid of the pathology altogether and just only focus on articles that are dealing with the history, I can do that. So I've got 3 articles that are dealing with the history of the disease published in the last 5 years. And the same thing, this one happens to be a free article. If I wanted to, let's take a look at the urology one. If we have this article, I know you want to click on the publisher link because it says full text. If you do that, what'll happen is that it won't recognize you as being part of Northern. And it'll prompt you to pay for it. And we don't want that. So to see if we have this article, I can click on the Northern icon. If you notice, the reason we only found a few articles is because history articles tend to not be a good choice for the journal databases. It's better to look at the history of a condition by looking at textbooks, or to look at the next source we're going to look at, which is a resource called UpToDate. And that will be a separate video. So this one we have online, I can click on the link to it. It goes directly to the article, gives me all the citation information. I click on view PDF, it'll download it into my reader. I'm Professor Mike Strahan, and if you have any questions, please contact me. Thank you.